Well, it's no secret that fentanyl-laced drugs have left their deadly mark here in central Indiana. And now new data shows overdose-related deaths are spiking in recent years in children.
Tonight, our Rachel Krause breaks down this concerning trend and why doctors are saying fentanyl is a problem that is not going away anytime soon.
Fentanyl is a growing problem here in central Indiana and around the country.
It's probably one of the bigger problems we've had here in recent memory as far as recreational substances go. It's unfortunately, a lot of people still don't realize they're taking it when they're using things like heroin.
Tyler Stepsis, chief of emergency medicine at Eskenazi Health, says it's much stronger than other drugs like heroin. And often people don't realize they're taking it or how much could kill them.
It can be deadly pretty quickly because it's just so much more potent and it causes a lot more adverse effects.
In Hendricks County, the Avon community lost 2 students to overdoses just in the past 2 months.
The days of going to a trusted dealer and having there maybe be some limited legal ramifications of that. Now, somebody can take a pill one time now and it's a fatal mistake.
But it's not just a problem in central Indiana. New data published in JAMA Pediatrics found more than 1,500 kids and teens died from fentanyl-related overdoses in 2021. That's 30 times higher than overdose deaths from 2013. In the last 2 decades, we've seen 5,000 children die from overdoses involving fentanyl. And more than half of those deaths occurred in the first 2 years of the pandemic.
We had, unlike a lot of things in 2020 when COVID came down, the substance use really didn't go down, and so we've kind of had a steady increase.
Stepsis says the majority of overdoses are in adults, but teens too can be impacted. Overall, Eskenazi's ER treats around 10 overdoses a day.
We live it every day in our emergency department.
He says to combat our nation's problem with fentanyl, having access to programs and doctors willing and ready to help treat addiction is key, along with safe using practices and access to Narcan.
It's definitely way more common than I think any of us would like to believe.
So, Rachel, we know about Narcan. What else should people do if they see somebody overdose?
Well, doctors and police stress that you have to call 911 and get medical care to the person that is overdosing. A dose of Narcan can help, yes, but it may not be enough. And if it is fentanyl, 1 dose may not be enough to stop the overdose altogether. And that is why it's so critical to get them to EMS or to a hospital so we can get them to the care that they need.
All right, Rachel Krause, thanks so much.